The population assessed during this 2-week period were patients with Alzheimer's disease, stroke, and depression, also dementia. The assessment tool used during the 2-week period is called the Recreational Therapy and Activity Assessment. This is used to Carolina goes in and does an assessment on a patient, and she asks them all kinds of questions like, do they like to read? Do they like to watch TV? Do they like to watch movies? Do they like to play bingo, dominoes, things along those lines? And then they rate it on a scale of 1 to 4, as previously stated in my report. And this helps with the reimbursement process of how St. Anne's gets reimbursed. This also helps with the client treatment, because then we know how to, based on the assessment, we know what kind of activities to put them in throughout the day. And if they like, and a certain case that I observed yesterday was that a patient likes to work on puzzles during the day. So what we can do is we can bring puzzles either to him in his room, or we can have him come to one of the activities rooms where they do puzzles, and he can work on that as he sees fit. But my one problem with the assessment tool that we have is that a lot of the questions follow what we do throughout the day, but there is one question that I feel does not fit in the assessment, and that is, where do you keep your belongings? A lot of times when we ask that question, the patients are like, well, I don't really care. The question was, where do you keep where would you like your belongings kept while you're at St. Anne's facility? And a lot of the times the patients respond, I don't really care, or I don't know, so that's the one thing I found during the assessment process that did not fit.